Hello everybody, my name is Dr. Szlarb. I'm a gynecologist and medical director responsible for international patients in IVF Spain in Alicante. Today we are going to talk about possible causes of repeated implantation failure. And at the end of my presentation, I'll be happy to answer all your personal questions. So, in order to get pregnant, there are three major factors that you have to take into consideration. The first player in the dialogue of implantation is good quality embryo. We have to be aware that we women, we are designed to have children before we are 35 years old. This is the moment where our eggs have the best genetical quality. There is a low probability of having an embryo with genetic abnormalities like Down, Edwards, or Patot syndrome. Later on, the story gets more complicated. So this is the moment where patients are coming to IVF Spain to look for help. We are developing embryos to day 5 to the blastocyst stage. We are biopsying them. We are performing trophectoderm biopsy to see if they are healthy or not. There's a certain age where things are getting super complicated. At the age of 43, 44, less than 10% of embryos are good. So this is the moment where we either look for them or patients are applying for a donation. The second factor that is very important is pregnancy-friendly endometrium. And when we talk about endometrium, we have to see two things. The first problem is the receptivity. We have to be aware that 70% of all the patients have implantation window with 5.5 days of progesterone intake. There are some women, 25% that has this implantation window moved, which need 6 or 7 or 4 days progesterone to open implantation window. So that's why in selected cases before embryo transfer, we are performing our receptivity testing upfront, or in IVF Spain, we are not waiting for you to belong to recurrent implantation failure before transferring the second embryo. After unsuccessful first transfer, we perform receptivity assay right away. In endometrium, we also have to focus on its immunology. We have to be aware that there are cells that see embryo as a foreign body, which can reject the embryo. And in the same biopsy that we perform receptivity mapping, we also do immunological mapping for NK cells, T cytotoxic cells, Th1, Th2 ratio, and of course, according to the pathology that you have, we perform, we put you on a certain immunological protocols to have an impact on the potentially cytotoxic cells that see embryo as a foreign body. So this is our dream team when we talk about implantation. The good quality embryo, the endometrium that we know what to expect from its receptivity and its immunology. So good genetically healthy embryo is the major factor that we are facing now. The women in Europe are planning pregnancies later in their lives. You see that in 1950 we had a lot of women, 27% women pregnant between 20 to 24 years old. So this is the moment where we have the best egg quality for a lifetime. and in 2017, only 14% of all the pregnant women were in this age group. The problem that we have now in Europe is the independence of women that we are gaining, that we study, that we grow our careers, that we use birth control pills to achieve our goals. So we have to face the fact that the best fertile years of our life nowadays we spend at school. So if somebody is planning pregnancy after 35 years old, you see that this is the moment where we either test your embryos genetically, or when you wait too long, when you are older than 43, 44 years old, the chance to have good embryos is very low, and this is the moment when we perform egg donation. So for us, it's very important when patients are coming to IVF Spain that we give you a decent diagnosis, that we tell you what is really going on in your body, what stops you from being pregnant naturally. So we always evaluate your ovarian reserve. There are 3 A's that belong to ovarian reserve: your age, your AMH, and your antral follicle count. When somebody's 20 years old, she has 80% of eggs and embryos which are healthy. At the age of 35, 50-50. At the age of 40, 20, 30% of our embryos are good, are healthy. At the age of 43, less than 10%. So these are the numbers due to our age. Our AMH. AMH stands for anti-Müllerian hormone or anti-Müller hormone. It's a hormone that tells us when we perform a cycle how many eggs we are going to retrieve. When your AMH is more than 2 in European units, which is about 14 in UK units, in mild stimulation with a short protocol, we usually achieve more than 20 eggs. If your AMH is between 1 and 2, which is between 7 and 14 UK units, we expect around 10 eggs. When your AMH is less than 1, which is less than 7, in UK units, we expect less than 10 eggs. So we have to be aware that the older we are getting, the lower number of genetically normal embryos or good eggs that we have. And then you really have to have good AMH, you really have to produce a lot of eggs so we find genetically normal ones. Antral follicle count, it's a transvaginal ultrasound that we perform. We have to magnify your ovaries and we have to see how many antral follicles, how many potential eggs do you generate. So each patient that comes to IVF Spain on the day of first appointment has this evaluation done, and we either decide that we perform a cycle with your own eggs, but we have to see if they are healthy or not, if your embryos are healthy or not, or your chances are so low, your advanced maternal age, your AMH is very low, that no matter what we're going to do at the age of 46, 47, it's going to be very difficult to find healthy embryos, and then we have to apply for an egg donation. So what we see here is the euploidy percentage rate due to our age. You see that our euploidy rate is higher when we are 25, 28 years old. It's stable until 35, and the number of good, healthy embryos is dropping down dramatically. And this is the moment where majority of young ladies in Europe are getting out of their schools, and this is the moment where they are looking for help of specialized reproductive medicine. I like this graph here a lot because it shows us that the Down syndrome risk is getting higher at the age of 35, 36 years old. But in the last 20 years, genetics has made a huge progress, and what we see is that it's not only Down syndrome risk, but there are also other syndromes. Down syndrome is too many chromosomes in the position of 21. Trisomy 18, it's called Edwards syndrome. Trisomy 13, it's called Patot syndrome. But there are also complex genetical abnormalities that are occurring in advanced maternal age, which we can test for in IVF Spain to select only healthy embryos, or if there's no embryos at all, then we have to apply for an egg donation. Male factor has been underestimated in the last 10-15 years of reproductive medicine, but the current studies show that 40% of all the couples suffer of infertility because of male factor. So I hate to receive files of patients where only female has been treated, or only female has a medical history form, and there's no word about a male part. So in IVF Spain, we always treat both. Yeah, we want to see the results of a female and a male. So on the day of the first appointment, all patients receive a sperm analysis from us, where we see the sperm quality according to World Health Organization criteria from 2010, where we see the sperm volume, concentration, motility, and morphology. We also perform DNA fragmentation, and all the patients with pathological results are receiving from us medical protocols to improve sperm quality. If the sperm quality is not improving and we still see the high DNA fragmentation, then on the day of egg retrieval and fertilization, the sperm goes to the magnetic cell sorter, where bad sperms, fragmented cells, stay in the column, and the rest, the good cells, are coming out. So in cases where patients have good AMH, we usually generate 16-20 eggs in a short antagonist protocol. All the eggs are getting fertilized, all of them are getting developed with the blastocyst stage, all of them are biopsied, and then in different age groups we have different euploidy rate, means different number of embryos which are healthy. So you can imagine, out of 5 blastocysts at the age of 35 years old, 50% of them are healthy. At the age of 42, just 10% of them are healthy. So sometimes out of 20 eggs at the age of 42, I have just one genetically normal embryo, and this genetically normal embryo has more than 70% chance to make you pregnant. So it's worth it to perform this embryo selection to move you from the average pregnancy rate at day 2, day 3 of development of 10-20% with a lot of fantasy to 70% with euploid blastocyst, or if the result comes back and all the embryos are unhealthy, then for us it's easier with the evidence-based medicine show you that we have to move on. So this is how ovary looks like. So IVF cycle, it's something called controlled ovarian hyperstimulation, means on the day of the first appointment, patient is receiving from doctor medication plan where we usually put patients for a couple of days and birth control pills to synchronize all the follicles, all the eggs. Then we stop birth control pill when it's convenient for a patient and doctor. We can adjust your cycle to your schedule, to the situation, and also now with COVID in March 2020, we had to reschedule 200 cycles. So with medication plan, it's all doable. When you start a birth control pill, you have a withdrawal bleeding, you have a period, and then the first 7 days of injection you put in your home country, you have to do 2 ultrasounds, and then the following 7 days from Monday till Saturday, you have to be here in Alicante on vacation, where we see you every 2 days. Then we perform egg retrieval, fertilization, embryo development to day 5, and you are flying back home. We have to be aware that if we apply genetical selection of embryos, embryos are biopsied on day 5. We perform trophobtoderm biopsy. Is the biopsy from the outer cell area, and embryos are frozen. And we have to be aware that we have higher success rates with frozen cycles and genetically normal embryos than with fresh ones. So your treatment with PGTA, it's 2-step procedure. Step number 1 is develop eggs and embryos, test them genetically, where you have to be in Spain for 1 week. And then the earliest 1 month later, you're flying here for 1 day for frozen embryo transfer. So for PGTA cycles is 1 week and 1 day treatment, that everything can be scheduled and adjusted to your needs. So this is how the results look like. So in the first picture, you see here the embryo, which is genetically normal, well, all the chromosomes, the number of them is correct. So this is the kind of embryo that we would like to transfer. Here in the lower picture, you see that there is too many chromosomes at the position 13. And this is Patot syndrome, and this kind of embryo will never be transferred. So the pregnancy rate without PGDA in women with advanced maternal age are about 18%, and the pregnancy rate with PGDA, this is something called cumulative pregnancy rate, means the more we work with you, the higher expectations we have, the bigger goals we want to achieve. Usually patients are coming here after many unsuccessful cycles in their home countries, and we just, wish you to have one genetically normal embryo. One euploid embryo is causing 70% pregnancy rates. So it's a lot, but it's still not 100%. Nobody can give you in medicine 100%. After 2 transfers with 2 euploid embryos means if after first transfer you have a miscarriage and we have 1 embryo frozen more, your cumulative pregnancy rate after 2 transfers, 2 frozen embryo transfers with your own eggs, with euploid embryos is 80%, after 3, 91.3. So the more often I transfer genetically normal embryo, the higher cumulative pregnancy rate. So we were discussing the strategy of a treatment for patients with good ovarian reserve, with high AMH. But sometimes we have patients in advanced maternal age and their AMH is less than 2 European units or less than 14 UK units. Means they have diminished ovarian reserve. means that if we do a cycle with you, controlled ovarian hyperstimulation or IVF cycle, we are going to receive less than 10 eggs and usually 2-3 day 5 embryos. The patients are very anxious because they do not know what's going to happen. And so in this kind of cases where you generate eggs and develop day 5 embryos, which are AB quality, which our lab is able to biopsy, and we recommend you to perform something called embryo banking. Means we develop 2-3 embryos now in one cycle, then we wait 2-3 months, and then we perform one cycle more. So we bank your embryos, where at the end, the goal, the target is to have 6-7 blastocysts, day 5 embryos, and then we see at the age of 35, 37 years old, about 50% of them are healthy. At the age of 38, 40, 30% of them are healthy. So I always say to patients that if they have low AMH, they cannot give up. If your AMH is less than 2, you have to work double to achieve your goals. And if we do 2-3 embryo banking cycles, then we are able to find genetically normal embryos in these age groups. Sometimes after 2 embryo banking cycles, when you are older than 42, we do not find genetically normal embryos, euploid embryos at all. And then we have to discuss the final step in reproductive medicine, which is an egg donation. So egg donation is a final step in reproductive medicine that we can offer you here in Alicante. Egg donation is performed in Spain since more than 30 years. Spanish legislation allowed for anonymous egg donation in the 80s. According to the Spanish law, we have to generate a child that will explain the combination of you and your husband, and then your egg donor and your husband. I always say to patients that we have to find you a twin sister, somebody who looks like you, has the same color of hair, the same color of skin. So when we meet one day and your child will run around us, everybody has to think that you are a genetic mom. So you can imagine that in our database, we have more than 500 donors available for you. We speak to donors. We speak to young people in Alicante regularly, and we teach them that they have to plan their lives, that life goes by very quickly. I know that, from the perspective of somebody who's 20 years old, it's very hard to believe it. But then when you have your own kid and your child is 20, and you think, oh my God, the time flies. But sometimes we have to think about it. When are we going to have our first child? If the answer is we want to have it after 35 years old, the best thing we can do for ourselves is freeze our own eggs. So there is a lot of young people in Alicante that come to us, they perform social freezing, and they usually freeze eggs for themselves. And if they decide to be our donors, we offer them social freezing for free. So that's why we have a lot of donors, more than 500 in our database for you. They are in 5 groups. Phenotype 1 are those with blue eyes, phenotype 2 with green, phenotype 3 with brown, phenotype 4 are those from Asia, phenotype 5 are those from Africa. In the second step of donor choosing process for you, you will receive from us paperwork where you have to describe yourselves, you and your husband. How tall are you, color of hair, color of skin. We'll be asking you what is important for you, which characteristic of yours your donor shall have. And then patients choose the phenotype the color of hair or color of skin, or people choose education, or people are allowed to put the personal note to describe some features of the donor's character that they wish the donor had. We have to make sure that the process is safe for you and safe for us. So according to Spanish law, your donor has to be under 35 years old, has to be healthy, screened for infectious diseases, also now COVID, screened for genetical diseases. I have to exclude cystic fibrosis and other most common diseases in European population, and they have to be screened for mental health. Then when we have your questionnaire prepared, we also will ask you for your pictures. We'll put your pictures and your description in the computer. Computer will show me 20 best donors available for you. We have a computer program which shows me shape of your face, eye, nose, mouth. 20 best donors are going to come out, which the computer has pre-chosen for you, and then we, all the doctors, we sit down together and we eventually decide who in our opinion is the best donor for you. So these are the steps of donor choosing process. The preparation of you for egg donation is very straightforward. So first we have to perform something called test cycle, where the good news for patients in egg donation is there's no injections for you. The injections are done by the donor because they are responsible for egg growing process, and you are in artificial mock cycle where with artificial estrogens and progesterone we are going to mimic your natural cycle. Means 15 days estrogens, day 10 of a cycle scan to see how thick your lining is, and then I know if this dose of hormones, this dose of estrogens is well adjusted to your body or not. And then in the transfer cycle, you are synchronized with the donor. You have a period at the same time. And then you bleed at home. Your donor is bleeding here in Spain. You will take oral estrogens to let your endometrium grow, and your donor parallel to you, she does injections to let her eggs grow for you. Then for egg donation, now because of COVID, we perform online consultations. I will be, as soon as British government allows us to travel, I'll be flying to UK regularly for patient meetings. And this is how we have a first contact with the patient. First consultation is either online or in our clinic in UK. Then on the day of first appointment, your medication plan is being created, and then we establish the 7 days time where you have to be in Spain with your husband for donor egg retrieval, and fresh eggs are fertilized with your husband's sperm. So that's why you have to be here. We have to wait for embryos to develop to day 5, and then toward the end of this time frame, of this 7 days, one of the embryos, one of the blastocysts is transferred, and the rest is frozen. And this, you see the cumulative pregnancy rate after first, second, and third transfer. So pregnancy-friendly endometrium. We were talking until now a lot about genetical quality of embryos, and we're talking about egg donation, when we have to apply for it. Very shortly, we are going to discuss the endometrium. In IVF Spain, we do not only focus on the thickness of the lining, which we wish to be between 7 and 12 millimeters on the day of a transfer. We also focus on the uterus lining physiology, means how the uterus lining works, because sometimes you have an amazing thickness of the lining but this lining is not receptive, it's not working at all. So in this kind of cases, we verify your receptivity and also your immunology through the uterus lining biopsy. So we perform uterus lining biopsies in artificial cycle. Everything here happens in a substitute cycle, means 15 days estrogens, 5.5 days progesterone, day 21 of the cycle, ultrasound, and the biopsy. Patients are kind of afraid of biopsies. It's an office, very short procedure. Usually, the whole preparation takes us more than the biopsy itself. Biopsy is coming to the uterus with the catheter and moving, the doctor is moving the biopsy catheter for 10 seconds to remove a piece of tissue. The half of a tissue is sent to receptivity, the other half to immunological testing. I have seen a lot of cases in my life where I transferred genetically normal embryos and I couldn't reach a pregnancy, and then performing the biopsy before second transfer. I was discovering the implantation window, which was moved, and some women have very short implantation window, just 12 hours, and then the embryo has to be put on time. The immunological testing of the lining is very straightforward. We see natural killer cells, Th1, Th2 ratio. When we choose a second donor for you, we see always the KIR receptor of yours, and we match your donors to you immunologically. When we talk about reproductive medicine, these are major things that need to be covered. When we talk about general immunology, which is a part of rheumatology, which is a part of internal medicine, of course, we do not discriminate anybody, but we cannot treat people with acute autoimmune diseases, and all autoimmune diseases, after certain treatment and collaboration with your rheumatologist, are coming down. And rheumatology, antiphospholipid syndrome, scleroderma, lupus are diseases that are going to be with you till the end of your life. We just have to find the best moment to transfer your embryos, that you are not in an acute phase. So yeah, me myself, I'm not afraid, to talk about it. I was diagnosed with autoimmune disease, and this is why I had to come to a sunny country, to Spain, to survive it, to feel better. And trust me, the Spanish sun is amazing for my joints. So I'm not recommending everybody to move to Spain, but we have to wait for the moment where, with medication or with the lifestyle or with the diet, with a combination of those three factors, your rheumatologist will get you out of the acute phase, that we are going to collaborate and wait for it. And then we are going to treat you when we have a green light from your specialist. The same is also with other diseases. We have patients that we treated after cancer here, collaborating with your oncologist. So we are not afraid of complicated cases. We just have to know when and how to help you. So the immunological part of reproductive medicine are the uterus lining biopsy and immunological matching of you and your donor, especially when we are looking for the second donor. So in IVF Spain, we are in the clinic in the country, which allows us to use technology in your treatment to have the highest success rate in Europe, to have your time to pregnancy as short as possible. and make your dreams of happy, healthy family come true. Usually, the average time that we treat patients here in IVF Spain is less than 1 year. So after first appointment, we make your medication plan, and you have a treatment time scheduled in 2-3 months. So for the question, if there's a waiting time, the answer is no, there's no waiting time. The day that we see you, we start working, we start planning, moving things forward. And usually after 3 transfers with euploidy embryos or after egg donation treatment, 90% of patients have children at home. So the first appointment now takes place virtually because of the COVID, and this is the moment where we we make a plan for your treatment, where you are getting ready either for embryo transfer or for egg collection. Embryo transfer, usually patients with euploidy embryos, frozen cycles, are planning for 1 day. For egg donation, fresh cycles for 1 week, where we have to generate an embryo, we have to develop to day 5 and fertilize eggs, develop day 5, so it's already a week, and put embryo back to you. Everything can be schedule adjusted to your holidays and the coronavirus situation. The treatment outcome and follow-up. So the patients are followed up by IVF Spain specialists until 12 weeks of pregnancy. Of course, we are not going to leave you alone after 12 weeks. So if there are complicated issues and your doctor in your country does not know what to do with you, of course, we are joining the team, and we are discussing our point of view, our opinion. Majority of our patients stay with us in touch for a long time. For Christmas, I usually receive undecent amount of chocolate and other things, and pictures of patients with happy children. So it's a long-term relationship. If you want to be a part of it, the contact with IVF Spain is either through a phone call or I'm providing email at the end of the presentation, or in our virtual Q&A lunch with IVF Bubble studies. So we're talking about theoretically, what has to happen, that we have to have 2 players, which is embryo and good endometrium, to make the dream team of implantation. Now we are going to put it to our cases. 42 years old, patient with low AMH, had 2 pregnancies, 2 miscarriages, 2 previous IUIs, and 3 IVF cycles. At the day of the first appointment, we see that in her ovarian reserve, she has only 2 antral follicles. So patient usually want to fight for the genetics till the end. So we performed 1 IVF cycle with genetical testing. We were able to develop just 2 day 5 embryos, 2 blastoses, and we see that both of them were genetically abnormal. One of them had a Down syndrome, and the other one had Pato syndrome. Patient understood that in this kind of situation, there's no matter what we're going to do, we have nothing to transfer. We have embryos from your own eggs, but they are genetically abnormal. The best we can do in this kind of cases is to apply for a donation, and this is what happened after first transfer. We had a healthy child. IVF Spain, we are a clinic that is recurrent implantation failure free, because we do not wait for 3 negative results on your transfer day. We apply modern technology to your treatment as soon as we can. So basically, when I transfer one euploid embryo, you should belong to the group of 70% of patients that should be pregnant. So if you are not in this group, we have to see why not. So then right away, before transferring second time, we are trying to find out what's going on with your uterus lining to support you and have you in 80% cumulative pregnancy rate after 2 transfers. So these are the most common syndromes, genetic abnormalities that we have due to our age, trisomy 21, 18, and 13. I will not talk about it, what kind of pathologies are involved in these cases. Serious pathologies. We do not want to discriminate anybody, but we want you to have a happy, healthy child at home. So these are the pathologies that through PGDA we are able to exclude to make your time to pregnancy as short as possible and have you in this high success rate. So this case study number 2, here you see a young patient, 27 years old, with a high AMH, 3.5 European units, which will be about 21 UK ones, 20 follicles, 20 untold follicles, means she's a high responder. High responder are patients defined which have more than 12 follicles in each ovary. She has never had a positive pregnancy test, 2 previous IVF cycle with day 3 embryos, and never pregnant. We always have to take a look, what can we do better? Of course, we can develop embryos to day 5, and we have to see what's going on in her lining, why she's not implanting those embryos. So we did IVF cycle with PGDA. We developed 25 eggs, 8 day 5 embryos, 6 genetically normal ones. So when you are that young, when we have so many eggs, we have to be aware that after 3 transfers, there's more than 90% chance that you'll be pregnant. So when you are that young and you have these results, in one cycle, we can do entire family planning. We can plan your children for now with embryos that we're going to generate when you are 27. After 2-3 years, we're going to go back for the second child, and we will have still embryos frozen from you when you are in your 20s. So I highly recommend you to perform egg freezing before 35, or if you believe that you are in a relationship that's going to last your lifetime, then generate genetically normal embryos. But sometimes you transfer genetically normal embryo and you still have negative results. So before we transfer the second time, we perform a receptivity map. We perform with 5.5 progesterone, and then the result came out pre-receptive. With a confirmatory biopsy, it came out that the patient was receptive on day 7. Near us, it's a very unique city called Benidorm, and there's a huge British community in Benidorm and also in Campejo now. I do not know what you girls do, but statistically I see that a lot of patients from this area suffer from this receptivity. So the implantation window of more than 20% of patients are moved to day 6, day 7. You can imagine that after correcting the progesterone length in the second transfer, we were able to achieve pregnancy. Patients usually after 1-2 unsuccessful transfers are getting anxious and they're losing their patience and they do not listen to us anymore. So quite often they want to transfer 2 embryos, hoping that they are increasing their pregnancy rates. No, in with euploid embryos, if I transfer 1 or 2, your chance that you will be a mom is more than 70%. The only thing that I'm increasing of transferring 2 euploid embryo is the twin rate. And we do not want to have many twin pregnancies in our office because it's always high-risk pregnancy. We always have to take a very big care of you during your pregnancy. Sometimes, you do not work when your cervix dilates so quickly. So then we have a problem. So I think, yeah, these were my cases for today for you. And if you would like to get in touch with us, please contact us under contact@ivf-spain.com. I'll be more than happy to answer your personal questions on our virtual Q&A launch, or I hope in March, April 2021, after the coronavirus pandemic, which hopefully the vaccine is going to end. We will be flying again regularly to UK to see our patients and have face-to-face consultations, which I miss a lot. Thank you very much for your attention. Have a great day. Bye.